Hello, everyone, and welcome to Inside the Industry. This is our recurring series with International Society of Cannabis Pharmacists. I feel like it's been a while since we've had an event. So I'm very excited to see you all joining us. We are joined by Dr. Raymond Velke and Dr. Travis Punai to discuss their roles as dispensary pharmacists. So we're going to start with a brief, semi-brief background on how you got to where you are today is how I'm going to phrase that. And then we'll go into some of your daily responsibilities and what your daily tasks typically look like. And then also want to go into some of the training that you received, whether that be state mandated or provided by your employer, discussing how you prepared for your position. So, Dr. Velke, let's start with you. Give us a little intro.
Hi. Yeah, thanks, Melanie. Yeah, I'm Ray. I am a pharmacist at a dispensary in the Pittsburgh area. So I went to University of Pittsburgh School of Pharmacy, and from there, my first job actually out of school was in a dispensary setting out in Philadelphia. So I went to what's now Curaleaf, but was called Herbology, and I worked there for about a year, and then I moved back home, where I currently have been working as a dispensary pharmacist at a dispensary in the area called Delta 9. I've been there for about 3 years now. And since then, I've been involved in ISCPH. I'm now currently the vice president. I was doing some clinical practice. I was chairing the subcommittee or the committee clinical practice and research, where we'd come up with different projects and try to either do research or publish papers or whatnot. If you're involved, I encourage people to get involved, and this is the best pitch. Well, I guess we'll talk. Maybe it'll come up again. But
Next meeting next month. Yeah.
next meeting next month. And yeah, I don't know. Other than that, though, just been, like I said, in this industry. I've been doing other things on the side. Like I worked in the MTM space. I've worked in the hospice space. Right now, I'm working at the Children's Hospital. So I've gotten just a bit of a little variety of experiences to try to bring back to but the cornerstone actually of my existence has been being a dispensary pharmacist.
Love it. Thank you. And in Pennsylvania, if that wasn't clear. I think it was clear, but just in
Yeah,
case.
Pittsburgh, Pennsylvania, not Pittsburgh,
Right.
Kansas, or whatever.
And then Dr. Punai, give us a little intro. Tell us about yourself and your background.
Sure. Much like Ray here, it's ironic. I did not know you worked for Curaleaf. I am currently their national clinical director. So I know, much of us know that the states function very differently, right? Pennsylvania is one of those states, I believe. You have a pharmacist per dispensary. Some of the others, not so much. So I cover a few states that don't require individual pharmacists per dispensary. So I try to, I'm usually covering a few of them at a time. It can be quite a challenge, but, trying to streamline these states and have everything sort of mirror one another, which in a perfect world, my vision is you would get the same quality of care across any state within the United States, but we have some time before we get there. What brought me here is I am a pharmacist as well. I've been a pharmacist for a little bit over 12, 13 years now. I was in that field for a good 16. When I speak to folks that are saying, "Hey, how'd you get into this industry? What brought you here? Did you study that?" Initially, I would have loved to have told you, yeah, I was prepared for a career in cannabis, but of course, we didn't have those 20 years ago. So even though I've always been a cannabis advocate, I did, pursue a career in pharmacy, and that passion for alternative medicine has always been something that's been in the background for me. And at the end of the day, you start to look at it as just another option. What's the best option for the patient? Is it going to be cannabis? Is it not going to be cannabis? And of course, I had a few years in the field, And I had an intern that was working in my pharmacy, and he said, "Hey, you know, my university or my pharmacy program is going to have a master's option in medical cannabis." And I was like, "Hey, you know what? That was something I would have prayed for 15 years, 20 years ago." So of course, I did pursue a master's in medical cannabis, and that is sort of what brought me, sort of full circle to where I am today.
I love it. Thank you for sharing. So I love that there's so many different opportunities for pharmacists in cannabis, but dispensary pharmacist I think is the most popular one. So I'm shocked it took us so long to actually review it. I'll share a little bit about myself too. I'll say my first gig out of pharmacy school was dispensary pharmacy, and I remember I saw the like job posting on Indeed. It was like dispensing pharmacist. And in my head, I'm like, yeah, that's what they do. We dispense drugs. And then as I read through it, I'm like, what is cannabis? Because at the time, everyone called it marijuana. So I didn't know. And then I'm like reading all about it. I'm like, this is so cool. I like, write up a cover letter and apply. Never heard back, but I really wanted it. So then I redid my cover letter and I focused it more on like my background with and mind you, I was still in pharmacy school at the time, but I had like helped different pharmacies set up like 340B pricing strategies and getting their Part B reimbursement set up, like those contracts. And so I try to like factor in like the law piece of it. And I think that is so important because laws are continuously changing, hopefully for the better in terms of, better access, better product selection. But sometimes it is an uphill battle. I think Colorado petitioned like 4 times to get PTSD as like an approved indication. Like it's just, and now it's like I think of a lot of these states, like PTSD is usually like the number 2 most common qualifying condition. So just it's a slow movement, but it is moving. So it's nice to see those changes. So tell us a little bit more. We'll start with Travis this time. We'll alternate. So Travis, tell us a little bit about if you want to talk about any like on the job training, but because you have that, but then you also did your master's, and I feel like some people would like to hear about that too. So do you mind? Let's start with the master's program. We'll start with that. Tell us a little bit about when you graduated, what the curriculum was like. Anything else you
Sure.
want to share? Okay.
I'm an advocate for the University of Maryland's medical cannabis program. It really did wonders for the industry and for sort of qualifying individuals to enter this industry. Um, you know, I will say it's a lot like pharmacy school. You're learning how to make informed decisions, right? It's great because it was not necessarily centered just for healthcare workers. It was a little bit broader than that. So you learn a little bit of the legal, you learn a little bit of the medical, you learn a little bit of the administrative side. And in truth, the way the industry is right now, you need to wear those hats. I would say that anyone in this industry wears multiple hats. It was a great program. I think it did help to prepare me to do my job to the best of my ability. In addition to that, kind of getting to the core of your question, there are some state requirements to become clinical directors or educators within the cannabis industry. The program definitely gave me a leg up. But what I would say is there's a number of training platforms out there that you kind of need to take a few of them and get the best of them because they all have something to offer.
I love that. And while you're still chatting, tell us also what kind of like on the job training you got. Were you like a dispensary pharmacist before becoming like I've already forgot your title. I'm so sorry. National pharmacist,
So I'm the clinical director, which is
clinical
essentially
director.
just a pharmacist that can, sort of cover multiple locations or multiple states. Um, on the job training, that's an interesting question. I like to point out to folks all the time that there really isn't a training program to make you a pharmacist within cannabis. No one training program. So, if we think about it, this is the first time that we've ever had, a career field within pharmacy. The first pharmacists to ever work within the medical cannabis space are us, right? Those that are in the industry now. So while you're learning, it's a constant effort. Dispensary training just kind of puts you out there. You're the first time, you don't have anyone to ask. So you have to utilize your skills as a pharmacist or wherever you came from before and sort of apply them to that role. Which, as I mentioned, I've been in pharmacy in a number of traditional avenues, hospitals and retail pharmacies over the years. So I think sort of applying my skill set from my cannabis training as well as my previous careers and sort of combining those two allows me to do my job.
I love that. Ray, tell us a little bit about your educational background, your training requirements for your dispensary role in PA.
Yeah, so in PA, you need to work in a dispensary period. You need to do this training. It's through what's called Train PAs through the state, and that is just anybody in the program at all. So whether you're working in the dispensary as a patient counselor or patient care consultant, whatever what we would call somebody at the point of sale, or you're a pharmacist, or if you are working in the grower processor, or if you're driving the vehicle that's transporting cannabis, like everybody's taking that. And then there's also for medical professionals, so to be able to have access to people's patient certifications, which by the way would be like what we're reviewing all the time, since it's not technically a prescription, since it's a Schedule 1 substance. So it's this basically written recommendation, as would be, that's how that would be described, but it's just something that's on that's accessible through the Department of Health website, and I can just access people's certifications to see if there's any the physician who certified them, what the certification was for, like which condition, if there's any restrictions the physician wants to place on the certification. And so that's to be a pharmacist that can that can review certifications, or to be a physician who is creating the certifications for the patients, you have to have done this medical professional training, which is like a 4-hour training. They refer to it as 4-hour training at least, and it can be offered by a few different providers, and the state sets. Actually, off the top of my head now, I'm kind of drawing blanks on if there are any
I used to
limits.
do one.
Yeah.
But yeah, there's like in person or online. I know what you're saying.
Yeah, well, so I know recently, this is a little A side, but like in I believe it's Alabama that's going medical, or opening up their program a little more. And I remember hearing about like yeah, in their law specifically, it gives like a number, like a cost for limit for what they can charge for these programs. It's like $500 or something like that. And it was like, oh, that's a lot. But that's they do just charge a lot for, on the order of hundreds of dollars for whatever, this like medical professional training. That again, this is what anybody who's doing anything with the certifications has to do, and that would just be so your pharmacists, your physicians, your PAs or nurse practitioners if they're involved. And then aside from that, which both of those kind of give general training, they might have some, it's probably more than what you learned about medical cannabis, which was like next to nothing or nothing in pharmacy school. So it's nice, it's a nice additional training. But again, yeah, like Travis said, there's a lot of on the job learning, and a lot of just being, I think, just again having experience in other settings where you're doing when you're researching topics or that are clinically based, or if you're, so for instance, if I want to know something about the safety profile of a drug, it's usually pretty easy to find that information. I can kind of just go to that drug. I could search that in any number of ways. I could go to the drug monograph, or if I wanted to really give a little more, scrutinize it a little more, I could go into any number of databases, we use Lexicomp oftentimes, and at least I don't know what I'm allowed to say or not allowed to say. UPMC, but we use Lexicomp. So that's things like that where you just kind of know where to look. And I guess with cannabis, it's weird because it's not something that's FDA approved, and it's not it doesn't have all of these RCTs that you can kind of look at. But then you take a step back and it kind of does, because like I said, if you're thinking about like safety or something, we've seen sky high doses of CBD in the form of Epidiolex, and it's like we're talking 5 to 20 milligrams per kilogram per day, which is a lot more than what my patients are using in the form of CBD, in my setting. So I already know that it's safe. And then there's just what we know historically about this, where we're just like, oh yeah, plenty of people have used this product in some form for a really long time, and we can intuitively derive that it's pretty safe. But there's some things that we might want to tweak, some things that might not be best for certain patients. There might be certain patients we don't want to use certain products, or certain patients we want to steer away from certain high doses of THC or something like that. But yeah, again, this is sort of returning back to, I think, taking what you already know as a clinician or as a pharmacist, and what you can find, which is in the form of things like information around dronabinol. And it's not quite, it's delta 9 THC. It might not be THC plus all the terpenes and other cannabinoids that you get in a cannabis strain, but it's a good picture of, again, the safety profile and the efficacy in certain contexts of THC. And then you do that, and you can apply that to what and then the other things I think of is, we're learning in real time, and the truth is we just don't have the hard evidence that, like, for instance, I can go off of some paper by Ethan Russo or someone who like talks about like a terpene doing something, and he's citing some either animal study or small human study or some it could be in vitro, and then you're just kind of like deriving from that, like, well, that kind of makes sense, this terpene does this or that, or this cannabinoid does this or that. And we haven't done like RCTs with it, so it's hard to know, is the dose what it needs to be to do the thing, or vice versa. So there's a lot of this gray and area, and it's all but you can almost think of it about it as all being off-label. It's just like all these off-label uses that make some sense, and like certain strains are probably a little better than others for certain things. And at the end of the day, we have like a decent picture of what this like does as a medication, I think. So yeah, that's kind of the I'd say, I don't know if they answered the original question about on the job learning, but just to kind of say that it's not that different than what you would be actively thinking about as a pharmacist in like other settings.
Absolutely. Tell us a bit more about like your typical day is like how I'd phrase that. So whether or not you're like, what is it, like telemedicine? I know that was an option for some time, and kind of like not just like your typical day, but like what your patients are looking like and what those conversations look like.
Yeah, so I will, like, the primary job purpose of a pharmacist in a dispensary in Pennsylvania is to check certifications and to be on site for, or not on site, just in ready for synchronous interaction with patients. So whether that means via telemedicine or not, but
That
which
sounds like a lot of legal jargon.
so we're all on site at my dispensary typically, unless something were to happen, like unless like one of us are sick and we couldn't really get coverage, and then we'll have somebody cover remotely. But typically we're just on site, and like I said, I'm checking certifications for each patient that walks in. So vast majority of the time there's nothing on the certification that I would like be intervening about. There's not really often anymore, at least. Doctors are less likely to put restrictions on certifications. Maybe in certain cases they will, and it would just seem like it was more common historically, and historically being like the 2 years or 6 years this has been around in PA, or 5 years of this program, so something like that. And in that time, I feel like I've found less information on those certifications, less likely to put a restriction or something like that. If there was, I would, address that with the patient. I would ask them if they, had talked to their doctor about this, or remember talking to their doctor about this restriction, or if they wanted to. But yeah, we'll get back to that. Otherwise, that's pretty much all I'm doing with certification, is making sure there's no restrictions and such, and everything sort of looks okay. There's a certifying condition marked off and so on. But then if a patient is new, they're coming in, and I want to, they have the option to speak to a pharmacist, or asked if they want to talk to a pharmacist. And I'd say, this is getting back to what I was saying a minute ago. I feel like it used to be more of a common thing that you'd have patients wanting consultations because they were completely new to the program. Now, oftentimes, I'd say a lot of new patients to our store, or aren't new patients to the program. They don't have as many questions, or have already talked to a pharmacist about medical cannabis. But you still do have some demand, and I do have, certainly, yes, still totally new patients, or patients that aren't totally new, but just want to talk to a pharmacist, and they haven't been asked that in a really long time. And now this is the first time in a while they've been to a new dispensary, and they're like, oh yeah, I guess I'll talk to a pharmacist. And you, in those consults, I just like to go through everything with them, their, past medical history, whether it's, what medications they're taking, allergies, their chief complaint. So thinking of it as kind of, you would have, like a CMR kind of deal. And then, maybe not quite as I's dotted and T's crossed as that, but this isn't going to insurance. But I'm gonna talk to them and try to get a good feel for what makes sense for them, and then and I'm documenting all this. And in case they do come back and want to talk to a pharmacist again, or talk to somebody, but yeah, I'm just going through with them the menu, which menu just has all the different products and the different categories of products, so I can kind of go through and be like, oh, this is why you'd want an inhaled product, this is why you'd want a topical, this is why you'd want a edible or ingestible or tincture, whatever. And these are the devices. This is what how to. So it's the idea of me just having a little bit more time to sit down and talk to them than maybe like some of the other patient care consultants that are handling patients at the point of sale, kind of. So I can just do more of that too. And then really the other thing is just I try to keep up on these tincture sheets. We have like, for the tinctures, since people aren't usually super familiar with them, I feel like often people are like, what's a tincture? And it's this oil that comes in like a dropper, and the amount, and I think patients just aren't used to being able to choose what amount they're taking, because the doctor doesn't tell them take X amount of this medical cannabis product. So you're kind of telling them, oh, this is what this strength is, and this is what this, and all these tinctures are different strengths, and it's about making it clear to the patient what amount they're taking and what that could mean for them. So that's kind of it.
Give me a percentage of like how many people come to the dispensary a day, how many of them are consulting with a pharmacist, whether new, or I call those follow-up patients.
Yeah, so I think it's now it's drastically, like I said, less than it used to be. I'd say it used to be more of a multiple times a day kind of thing, or maybe I'd go one day without, but like the next day I'd have 5 or something like that. To now it's more like a couple times a week sort of thing. So definitely days without consults.
Wow. I'll just chime in and say, in my state of Minnesota, we all the pharmacist has to meet with every new patient, whether they've been to a dispensary before or not. Doesn't matter. If they're new to us, they had to see a pharmacist, and those would take like a solid 30, 45 minutes, like just depending on how much education we had to provide. And then the like follow-up consultations could be 15, 20 minutes, but those would be like an all-day thing. Like we'd be open from like 8 to 8, and we'd probably have like, I mean, obviously the number of new patients varies, but there'd probably be like at least 50% of the people coming in that would need to speak to a pharmacist. So it is nice to see that they don't need you as much, but it's still nice that you're there.
Yeah, and I do wonder if because there was a time when I remember earlier in the program here, at least 2-3 years ago, it would be a thing where I don't think it would have been uncommon for a pharmacist to have like 20 consults in a day at certain stores, depending on their store's
Yeah,
policies or
that too. The
things.
busyness.
Like, yeah, or yeah, but
It's
like
all about the location.
and location, but yeah, I think that there's like I said, I'd be curious as to what maybe some of the other cannabis pharmacists in Pennsylvania have to say about this, because yeah, in my experience, it's definitely went way down. I don't know if other stores are seeing more consults or not, but yeah, I
How
guess I
about you,
can't
Travis?
say.
Thank you, Ray. How about you, Travis? Tell us about I already forgot the original question. Daily responsibilities. Um, what else was it? Like a regular day. Walk us through your regular day.
So there is not a regular day. In my world, there's not exactly a regular day, but if I had to, sort of give you a rundown of my responsibilities, it would vary between, of course, patient consults. Now, many of the states that don't require a pharmacist consultation or not even necessarily an offer to a consultation, that's one of the challenges out there is networking with the providers in the area, right? Those that are giving the patients their recommendation for cannabis, but they can't necessarily discuss products with them because they're not familiar, right? We all know what happens in a dispensary is much different than what happens when you read a book or what happens when you're, seeing patients on a you know traditional medical office visit. So letting those parties know that there is accessibility to healthcare practitioners at the dispensary level is one of my challenges. In addition, of course, product training, um, sort of introductory training for employees or floor staff that are going to be the front line. They're going to be the ones that are speaking to our patients for the first time. And we've been into a variety of dispensaries before. Sometimes they don't always seem like the environment that you'd want to walk into and discuss your uh, you know personal medical condition with, right? So what I try to have a focus on when I'm training employees is, be aware that these patients are there. It's your mother, it's your sister, it's your grandmother. Take care of them, offer them everything that we can offer them. And I want your ears to perk up when somebody mentions a medication or if they mention a medical condition, even if it's, hey, my sciatica is acting up today. It means that that's a genuine concern for that individual. So making sure employees are able to identify those patients and connect them with the right resource, which, in some states, just like you mentioned, there's not a requirement to have a medical consult. Getting them in contact so I can do that medical consult. So that's probably what I'd say is predominantly under my umbrella is networking with practitioners within the cannabis space, educating our employees, and then absolutely, our medical consults. Just as Ray mentioned there, sometimes it's just explaining how a product works, right? Making sure they know that it takes 2 hours for an edible to kick in. What's your dose? How do you approach dosing? And then I would say that sometimes these cases get so complex because the patients are turning to cannabis for the first time. Their back is against the wall. Whatever they've used to treat their condition in the past did not give them success. So they're walking in and going, "Hey, how can cannabis help me? I've heard a lot of things, but nobody can give me a solid answer." And I think sometimes that does require a bit of research. Um, just a quick example of as a pharmacist, we usually have these drug interaction checkers built into our software, right? If in traditional pharmacy, you don't have that in cannabis. There are a few out there, but they're not wholesome, they're not complete. So we got to go dig up those. What does CYP1A2 do? And is that going to interact with this product? So sometimes bringing your expertise and just kind of thinking outside the box so you can get correct and more accurate information to patients is something that falls under our umbrella as well.
I love that. I always say when I worked in a dispensary, it was like the best parts of retail and ambulatory care because I could have that one-on-one interaction with the patient, but I didn't have to worry about insurance coverage and prior auth and all that annoying stuff. I work for an insurance company now, so I can say that. So I know it's annoying. So that's great. But it truly is like so important to have that patient education piece. Out of curiosity, Travis, um, which states, because I know you're in Maryland, that's like your home base, yeah?
Yes, yeah, that's
And there
correct.
are pharmacists there in the dispensaries.
There are not necessarily
Oh,
pharmacists in dispensaries. There is a requirement that patients can have access to a pharmacist, whether that be a tele, visit, a Zoom, or even a call center sometimes. That does happen. I will say that majority of the dispensaries that I've worked in, I have made a constant effort to, have a presence within the dispensary just because I feel like it's valuable.
yeah.
Um, just think about how many times you've walked out of a pharmacy and you might have had a question right then and there, but if there was no one there to assist you, that question goes unanswered. So I think it's kind of important to try to, push for that presence. Let folks know that they have access to that information.
What other states don't require pharmacists that you're involved in? Florida? I feel like you guys are in Florida.
The company is in Florida. Florida does not have pharmacists or even really a pharmacist requirement, even though they're a completely medical state, quote unquote medical state.
Yeah.
So, that's a challenge. Ohio's much similar to Maryland. It does have a requirement to offer that access. But there's not necessarily a defined rule of, hey, they need to be on site X amount of hours or how that plays out. I will say that I'm somewhat fortunate to be in the position that I am and to sort of be in a position to advocate for access to healthcare practitioners. And you know ideally, and this is something that I'm working on, I'd want my patients in Florida, even if they don't have a single requirement, to have access one way, for shape or another, to qualified guidance, really.
That'd be great. I think that's like the idea if like it ever was in a pharmacy, like you'd have access to your pharmacist anyway. It's just making sure that they're trained as well, because obviously it's not really touched upon in pharmacy school. Okay, I will also mention, because I feel like your company, Travis, is vertically integrated. Is that
Mhm.
right? And then Raise
In
is not.
many of the states, yes.
Yeah, in many states. So my company was also vertically integrated and I loved it. I loved being able to have like the ins and outs of all the little products that we sold. And in my state, it was like a duopoly. So it wasn't like that many products that were offered that I needed to memorize to understand. So I feel like that did make it a lot easier, especially when I look at states like Oklahoma has like almost 200 dispensaries, if not 300, and like that's insane. Like everybody product like markets their products differently, and I think that's so much harder to like understand and communicate, let alone you're in the dispensary, you know what these products are, you know THC and CBD, you can read labels, but like physicians, like they're not taking the time to do that, and let alone patients, like trying to understand all the different nuances. So very important, but very expensive to vertically integrate. Okay, so we have time for one more of my preset questions, and then we can open up the floor in case any of our attendees have any questions. If you do have questions, I forgot to mention this at the start, please put it in the chat. That way I can like direct the questions. I don't know if we're gonna have time to unmute. It might just be easier to put them in the chat if you can. And our last question here is, what resources would you recommend for anyone interested that in a dispensary pharmacist position that you think would help them on their personal, professional, career development path? I don't, I should call on someone. Travis, I'm going to call on you.
Um, that's a loaded one. I would say that there is no one resource out there, right? It's a constant effort. Um, you need to stay, you know, be adaptive. Try to stay abreast. I would say get involved with a handful of good groups. I International Society of Cannabis Pharmacists, SCC. Those have been really good ones. There's a few others out there. Like I said, I was fortunate enough to join a program, but that's quite a commitment, and does come with a cost as well. But I would say the key thing to someone who's trying to pursue a career in in cannabis, would I'd say be adaptive and be passionate and ask yourself what you can bring to this industry. As I mentioned earlier, there's no defined role. It's not like, if we go to retail pharmacy, I kind of know what I'm supposed to do in a traditional pharmacy setting, right? In cannabis, that's not there, and there's no one to ask. So what you need to do in order to sort of bring value and make an impact on this industry is acknowledge the gaps that are in this industry and what can we bring to this industry to fill those gaps. So for many of us, it was, hey, there's not enough medical focus on in the world of cannabis, and we really want to be players in this game. We really want to make sure that we don't take our eyes off the ball, because you know there's always challenges in this industry, and if we're not paying attention to one thing, we're paying attention to another. So I say stay adaptive and be passionate. Passion is definitely a number one. I wouldn't enter the cannabis industry for financial reasons. I wouldn't say, hey, the money's there, I could just live the way I thought a pharmacist could or a physician could. It's going to have its challenges, but if you're driven, I think you could bring something to the table, and we can shape this industry ourselves into a direction that, you know, we see, at least as healthcare practitioners, will be beneficial to the patient population.
That was great. Thank you, Travis. Ray, you're up. What advice do you have?
Yeah, so yeah, I definitely second that about being driven and the idea that it's not a super defined role. Like, I think that that's like a really important feature that I remember, like when I started at the dispensary in Philly, I like was kind of just standing there and looking around and not really knowing what I was, like, literally didn't know what I was supposed to be doing because it wasn't really being explained to me. Like, it was more of almost a formality that I was there on site, and there was an understanding that, like, oh, patients might ask for to talk to the pharmacist, and there's like a book that had some information that I was supposed to read. It was very like, yeah, nobody's there to really tell you how to pharmacist unless you happen to already be in a role where you come across a pharmacist that's been there. I feel like that's been the idea. But yeah, so with that being said, I think yeah, you do kind of have to create your own thing, and kind of, aside from what's required by the state you're in. So in my case, in Pennsylvania, it's really just these consultations and these and reviewing the certifications. And there's still downtime because we're not like doing this 100% of the time. So I do things like do things to stay involved with ICPH, which, again, going back to the original question, resources, ICPH, good resource, not biased here at all. But yeah, definitely, whether you want to get involved, and I think that's just an important thing. Like, the more you want to learn about something, or the best way to learn about something is by getting involved and working on projects where you have to do research, and then you engage in material, and then you find out, like, wow, there actually is a lot out there. Like, we're not working on, again, maybe the same level of information, or maybe, or that's, see, like, I don't even like framing it that way, more like the doesn't meet certain standards or isn't hitting certain, you don't have that ability to push the liability off to guidelines that are telling you what to do. You kind of have to make inferences about what you're looking at. But at the same time, there is a plethora. There are some FDA approved cannabinoid or cannabinoid adjacent medications. There's going to be international studies that do talk directly about cannabis in like a smoked form, or cannabis in a some kind of or mucosal spray like Sativex. So yeah, again, just the original point. I think like resources are just kind of a lot of this similar but different from what you'd be, yeah, in any other pharmacy situation. But it is with that caveat that you can kind of like mold it to what you want. Kind of, you might have more of a role uh, doing. I mean, yeah, you can do things like create patient facing material and such, and then maybe you do have to get. There might be certain barriers to utilizing certain information that the state isn't super clear about what you're allowed to give out to patients as information, right? But I think that there's things you can do to at least advocate for what we should be able to. There's what we talk to patients about, and then there's like graphics and materials that I think like take a little extra level, and that's where I like to deposit that creativity information into ICPH. So again, that's kind of the original idea, where you can learn a lot and give back a lot through that way. And so it's both a resource where you're going to learn more, and you're going to also be able to, yeah, again, develop things and get kind of comfortable as a clinician in the space. So that's about it.
Love it. I forgot to unmute. Sorry. Thank you, Ray. Okay, so we do have some questions in the chat. First one was more of like a comment. I'm in Florida, received my MS in medical cannabis science and therapeutics. Hey, Michelle, feel like colleague here. Love to be more involved with the cannabis industry in Florida, but they do not have pharmacists in the dispensary. Blows my mind. Blows my mind. Just absolutely. How they can call that a medical program without any medical involvement. And then it's like putting that pressure onto like the bud tenders or whatever they call them there, because now they're forced to do that. And I'll never forget. It's like walking through my waiting room in between appointments, and I heard one of the techs, we called them technicians, like a pharmacy tech, but a dispensary tech. And she was like, ma'am, I don't know what a PE is, but it's fine. You can still use your vaporizer. And I kid you not, my heart stopped. And I was like, that is a pulmonary embolism. And I doubt she will want to vaporize. So tell her the pharmacist will call back, because you're going to give me a heart attack. So it's like, we know the jargon, and, other people hear PE and they think, oh, like physical education. It's like when you're in the industry from a medical perspective, you just understand the differences. But I will say, while I'm on my soapbox, I hate how many acronyms there are in this industry, and like so many unique names. One of the things, is this my committee or yours? Quality assurance. It's yours. It's yours. CP. We just adjusted our committees, so it's like still taking us a little bit of a transition.
It's technically me.
It's Ray. This is Ray's problem. Okay, so Ray is working on with his committee, like a glossary of terms, just because first of all, every state has different definitions, and we'd like to standardize that. Like that is our goal as a society: standardize education, standardize product selection, standardize terminology. So I'm learning a lot myself. Butter with a B, with the BUDDER. Like these are all different terms that people will use, and they don't know what they're really saying, what they're meaning. So I think very, very important to have our glossary. Still trying to come up with a cool name for it. So if you're interested, reach out. And then, oh, this is a good question from Laura. Laura is a P4. So congrats to almost graduating. You're in the home stretch. With the potential for rescheduling cannabis to be a Schedule 3, how do you see the role of the pharmacist shifting in that scenario, and how do you feel about it? I'm going to answer first because I'm already unmuted, and I will say we just wrote up a draft to send to Senator Schumer. Is that his name, Schumer? Feels like it is. Charles Schumer. Okay, Schumer. And I still have to like put it on a letterhead, but I say as a society, we're definitely for it because it'll improve access, it'll improve research, and like that is the biggest hurdle right now. Doctors will argue there's not enough evidence. How do we know it's safe and effective? But what is Schedule 1? High potential for abuse, no medical use. Like, okay, you have like 30 plus states that are medical. I don't even know how many countries, 30 plus for sure, because Sativex or Sativex is approved in 30 plus countries. So there's clearly some medicinal benefit, but I think the challenge is that it's so personalized and unique dosing that's required that it's not like a one pill fits all type easy dosing. So, Ray, tell us, how do you feel about Schedule 3? You want the DEA on your back? Just kidding.
Yeah, no, no, I think it's interesting because yeah, to your point, yeah, it obviously increases access. It increases the ability to do research. It sounds like it's sort of just clear, like it has a sort of net positive feel to it to just not be a Schedule 1 substance. I think that's easy to agree on. I do think it's hard though to like. I think it opens up question about what happens to medical cannabis space if it does just all, there's a version of this where it all just goes into pharmacies, and then you have pharmacists confronting a variety of dosage forms that they're not maybe used to. Maybe that's where standardization is important, but like medical cannabis, as I think of it, as I've been exposed to it, is would be pretty alien, I think, to a retail pharmacist. And like if they just all of a sudden were like, oh, like I'm the person who is dispensing all of this stuff now. So I think it would have to, I think we might see some clever designing, or maybe the states will just continue to ignore the federal law, which is what we have right now in essence. So yeah, I don't know. But like I said, net positive because yeah, not being Schedule 1 just allows you to do more with it, and then you can have I think you will have companies that do manufacture drugs doing RCTs on medical cannabis in different forms, and you might have like a Pfizer cannabis cannabis or something, and it'll be in a bottle, and you get that at a pharmacy, and the insurance covers it, and that'd be cool, I guess. I mean, the ability that it could be covered by insurance, and again, just sort of thought of and worked into people's drug regimens in a more seamless way.
Thank you, Ray. Travis, you're up. How do you feel about C3?
I'm all about it for the, taking it out of Schedule 1, right? I think we're all in accordance here with that, is that, I want to say this industry stands on a medical leg, with those minor trials and research that's been done outside the country. And then we quickly forget that because the way the industry, sort of seems is that it is a little bit more recreationally focused. The challenge is, just as Ray mentioned, how do you put the cat back in the bag? Folks are used to being able to purchase cannabis in the majority of states right now without a prescription. Are they going to accept that? Are we going to create a third, sort of outlet that's somewhere in between traditional retail and your typical cannabis dispensary? I'm all for the reschedule. How we do that, I'm not a politician or a lawyer, even though that might be a hat that I may be required to wear at some point.
Could
But
be a lobbyist. That's for sure.
well, I guess I am a politician if
The
that.
suit makes you look like a lobbyist now.
But yeah, exactly. It'll be a challenge, but I'm definitely all for it. I think that is really what we need to be lifted in order to truly make some advancements and spread that acceptance among medical practitioners that are out there that are like, hey, where's the data? You know?
Yeah, a stigma is a part of a plant. Um, the other thing, I personally, like the society has a view and then I personally have a view. I want to Schedule 5, like Sudafed. I want it behind the counter. So like you just need to talk to a pharmacist. Like that would be like ideal for me. Can they sell Sudafed in gas stations? I feel like they can. Like they can't, not anymore. it's been so long since I worked in a pharmacy, but I remember like we had this like really archaic book that we would like write down people's purchases of, and it's like
In my
years
experience,
ago.
it's changed recently. I believe there's a if it's not national, it's definitely statewide, an electronic system that folks sign when
Oh
they
wow.
pick up Sudafed to ensure that they're not crossing state lines and buying more, etc.
It took a while.
Yeah, took quite a while,
In
but
Minnesota, we have a registry, but because cannabis is Schedule 1, it's not in our PDMP because PDMP, like per our state definitions, is like Schedule 2 through 5 or 4. Yeah, 5. 5 is in there too. It's like Lyrica. Pre-Gablin, we should use generic names in our discussions. Okay, we have a couple more questions. I know I told you it would only be 45 minutes. Are you guys still okay on time? Okay, we got some head nods. All right. Um, John, John said you, Travis, you mentioned networking with prescribers. In what way do you go about that?
so yes, I that has come about in almost every which way possible. As I mentioned, I've been in the cannabis industry for a few years now. So I've kind of seen the programs sort of in their infancy, still probably in their toddler stage right now, but I've had to make the cold calls. I've knocked on the providers' doors, answered questions for them, make sure that they know that, hey, maybe you're a recommending provider that doesn't get a lot of questions, but maybe there's that 1 out of 10 that's like, hey, I have this rare condition and I take 20 different medications for it. Who do you send that person to? I need that practitioner to know that you can't just send them, or you probably don't want to send them just anywhere. You want to make sure that they have access to qualified guidance, somebody who can look at those medication interaction checks and help them make an informed decision as to whether cannabis is even right for them.
It's great. Okay, there was another question I skipped, my bad. I don't know. I don't know which one of you want to answer this. What are you prescribing? This is from David. What are you prescribing to patients? Strains, delivery systems? What would you recommend if somebody wanted to smoke safely?
Yeah, I can take that. So if a patient comes in and like I always go through kind of a similar spiel when I'm breaking down the menu with the patient, and maybe they're instantly like, I don't want to inhale anything, and then I know to kind of skip that part or whatever. But I like to kind of make sense of it to them. Like, you'd want this for more fast acting relief, and it's going to be shorter acting duration versus something that's going to be longer acting and maybe better for preventing the thing that you don't want to happen, like pain or anxiety or whatnot. But like whenever getting into inhaled products, the way I often describe it is that like you have you have cannabis that is in disclaimer, in the state of PA, it's cannabis is supposed to not be it's not supposed to be combusted or smoked. It's supposed to be vaporized. But it's even been like
You're
the
obviously enforcing that at
basically
people's homes.
that's clear. That's clearly I'm clearly enforcing it. No, the thing is really the practical nature of that, since we know that so many patients are going to smoke cannabis because that's just how it's kind of commonly been done for a really long time, is we can't supply anything that is any device. We wouldn't sell lighters. We wouldn't sell pipes or water pipes or what have you. All your fun terms. We just have dry herb vaporizers and vaporizers for concentrates. And what people are most familiar with, the vaporizers, the atomizer or battery that would be for the little carts, or what we call pens. So like vaping being, I think, in theory a little safer than smoking, because you're not inhaling as many other particulates as you would if you're burning a product. You're inhaling a lot of, I mean, there's been studies that looked at headspace, like gas chromatographic analyses of headspace, where they can see like, oh, there's plenty more carbon monoxide, or there's even plenty more carcinogens in there. But I mean, I think what we see over time is like, and I'm getting a little off here. I'll try to bring it back real quickly here. The idea being, I think that there's reasons to think that smoking isn't great, and it's probably not great for, especially for certain people. But at the same time, there's not a ton of evidence that shows that smoking cannabis is going to cause long-term health defects in people. So it's going to have that acute bronchitis, is the fancy medical jargon. Might make you cough a little more in the moment, or even in the days to pass. But there's no reason to think it's going to really cause like a COPD or emphysema, or worse, like lung cancer. So I think that, or at least in studies, it shows equivocal, results to what something that would be. It's where we know that tobacco is unequivocally, a cancer-inducing agent. Something like, cannabis doesn't really show that. So all that to say that I start from a place where the smoking doesn't concern me, maybe as it does maybe some other providers or professionals. But I think that a much safer way to go would be in vaporizing would be using dry herb in a vaporized form. Like, I think that just sounds, there's less variable than in concentrate, where we know that it's went through a process and there could be some residual solvents and what have you. With when you just have the dry leaf, I mean, sure, there could be pesticides, it could be this or that. I mean, they still run these. I mean, I can see lab reports where there might be still things on dry leaf that I might not be crazy about. It still went through this process of trying to make it perfect and to keep it from dying, right? And it might be a little less natural than if I did this myself or something like that. At the same time, it's more or less going to be something that I think of as a safe, and safer than if you smoked it. And going back to the vaporizing point, you're just doing it at a lower temperature, and you're not inhaling as much particulate. So it's a roundabout way of saying, yeah, I'd recommend a dry herb vaporizer, but I think that most forms are relatively safe.
Great. Travis, do you have anything to add to that?
No, not much. When I have to explain that to patients, I usually end up somewhere along those lines, is that, yeah, if you want to meet the two most popular inhalation methods in the middle, dry herb vape. But I also tell folks, we know our problems with inhaled cannabis. We've had 3,000 years of folks smoking inhaled cannabis. I've only had about 3 years of people using vapes. And we've already had a few hiccups there. I think Pennsylvania is one of the better states that does ban a lot of the additive and botanical terpenes to kind of make those products a little safer, so folks can count on them in the traditional, cannabis oils. But yeah, cannabis is about 3 to 5 times as potent as it was, pre-1990. So hopefully the patient doesn't need to inhale a lot if they do choose to go that route. But I agree full-heartedly. The dry herb vape sort of meets you in the middle there.
I like that. It's the happy medium. All right. Well, if you guys do have additional questions, please put it in to our email. You can respond to your event that got you here, and it'll come to our inbox. Otherwise, it's info@cannabispharmacist.org, and you will see this recording on our YouTube page. And I'd like to thank our speakers here, Dr. Raymond Velke, Dr. Travis Punai. Thank you for taking time out of your evening to join us, and stay blessed. I don't know a good sign off. I'm still working on one.
Thank you, Melanie.
Great. Thanks for having us,
You guys take care. Be safe. Bye, everyone.
everybody.